Oh my God, you guys. I just had the really most heartbreaking conversation. I'm phone banking. I was phone banking into Kentucky with a group called Surge. So we're doing deep canvassing phone calls. It's to help elect Andy Beshear, who is the Democratic candidate for the governor. The election is in November. But they're deep canvassing calls. So we're talking a little bit longer with people and asking them a few more questions. And I talked to this woman, Julie. So she was 43 years old. And I asked her sort of what was important to her and, what her vision was for Kentucky. And she started talking about healthcare. And it turns out that she doesn't have any healthcare. So she's a server. She works in a restaurant. She works 7 days a week. 7 days a week. She makes $2 an hour plus whatever tips. And she doesn't have health insurance, so she hasn't been to the doctor in 10 years. She can't, she says, because she cannot afford a bill. A surprise bill that would come in. $1,200 bill. She said she got one of those before. She couldn't pay it and it destroyed her credit. So she's like, I just don't go. She said, I'm pretty sure I'm sick with something. I'm sure there's things wrong with me. I can feel it, but I won't go. It was devastating, honestly. I asked her why she wasn't on Medicaid. And she said, well, because I don't want to be one of those people who abuses it. And I said, but it's made for people like you. You are exactly the kind of person who's supposed to be on Medicaid. She said, yeah, but I was raised to believe that people abuse it. I don't want to be that person. I literally could not get through to her about this. She was like, you're being so kind, but no, I can't do that. It would be abusing it. I just feel shattered by that conversation. Not least because we got cut off before I could tell her that this gubernatorial election is really important, because should she decide to go on Medicaid, and I might have persuaded her, I might have gotten her to a point where she believed that she deserved to do that. But if this guy Daniel Cameron gets elected, this Republican, he's opposed to Medicaid expansion. He believes that people should only get a tiny bit of Medicaid and then they should be cut off. He thinks people should, have to fend for themselves. He believes that the ACA should be eradicated. He believes that there can be no abortion and there should not be birth control pills. That is who is angling for the Republican gubernatorial seat in Kentucky right now. And meanwhile, we've got people like Julie who haven't been to the doctor in 10 years. Do you see how poisonous the Republican agenda is for regular Americans? It is shattering. For the record, healthcare is a human right. Everybody deserves healthcare. Everybody deserves to make a livable wage, and everybody deserves a 5-day work week. Julie, I'm sorry we got cut off, but if anyone knows her, please tell her, and please make sure she votes. It matters.